Hello, 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 everyone. Welcome back to another episode of Doctors Go Live. Today, we are talking about diabetes during pregnancy. Let us know who's tuning in right now, where you're tuning in from, and share with us what would you like to learn in today's episode, Diabetes During Pregnancy. Okay, now, if you share this video out as usual, we have a special treat for you. You get to take part in our Doctors Go Live quiz, which is happening right at the end of the Q&A, where we have some Columbia Asia water bottles up for grabs. All right. Hello, everybody. Hi, Cecilia, Shafika, Lily, Curtis. So nice to see everyone here today on a Wednesday afternoon. All right. So again, if you, as usual, if you share this video out, as mentioned before, you get to take part in our quiz happening later. But also, we today's episode is really exciting, okay, because we have consultant obstetrician and gynecologist all the way from Columbia Asia Hospital, Miri, Dr. Khai Cherng. Okay, now people with diabetes are already at risk of multiple health complications. But what happens if you are pregnant and then you suddenly have diabetes? Gestational diabetes or diabetes during pregnancy can happen at any stage of a pregnancy and can cause problems for both mother and child during pregnancy and after birth. But what puts you at risk of getting diabetes during pregnancy? How do you know if you have it? Okay, how will it affect you or your baby? And are there any treatments for this? Yeah, so we are covering all these questions. If it's running through your mind today, you are at the right place because all this is happening right now on Doctors Go Live. So if you know someone who suffers from this, or if you think somebody who's worried about this, or if you think this is such an important topic and it's going to make a difference to someone out there, then please share this video out. Share it on your social media, tag your friends, follow us on our social media because this episode is definitely going to help somebody out there and make a difference in their lives. All right. Hello, hello, everybody. We're seeing the usual people. Lily, Ara, welcome. Shafika, so nice to see you. Now, if you've just joined us, welcome to another episode of Doctors Go Live. Today, we are talking about diabetes during pregnancy or gestational diabetes. Now, diabetes during pregnancy can happen at any stage of your pregnancy, and it can cause problems for both mother and child. But these risks can be reduced if the condition is detected early and is well managed. All right. So to help you be informed and reduce all this risk, we've got you our expert from Columbia Asia Hospital, Miri. Please welcome consultant, obstetrician, and gynecologist, Dr. Khai Cherng. Hi, Dr.
Hello,
Sun.
everyone. Hi,
Welcome.
thank you, Nina. Yeah.
Yeah. Jennifer is saying she is from Miri. So you've got I think you've got a fan club from Miri probably going on. So welcome, Doc. Thank you for joining us today. Okay.
Yeah.
So also just a reminder, right at the end of the show, you want to take part in our Doctors Go Live quiz where you stand a chance to win some Columbia Asia water bottles. So please pay attention to what Dr. Soon has to share. Okay. Can I count on you for that? Let me know in the comment section. So if you have any questions whatsoever as well, please tap it out in the chat function. And then right at the end of my interview, Dr. Soon, we're going to address all your questions. Okay. So, Doc, thank you so much for joining us. First things first, Doc, can you share with us a little bit about yourself and what is it that you do? Yeah.
Okay. My name is Dr. Khai Cherng. I born in Penang, and then subsequently I decided to do medicine, and I studied in Moscow for 6 years, living in now Russia is famous for the war. Luckily, that time is not during the wartime. So after the 6 years, I joined my housemanship in Sarawak, which is in Sarawak General Hospital. So since then, I stay in Sarawak for up till now for almost 10 years. So I did my housemanship MO and joined the ONG in the coaching for almost 8 years. Then subsequently, when I become specialist through the MRCOG program, I was transferred to Limbang Hospital. So just to enlighten Limbang, anyone know about Limbang? So Limbang is a place that is sandwiched by the Brunei.
Yeah.
So it's a very small town there, and then you want to go out. Especially during the MCO, the Brunei lockdown, end up the people were just trapped inside the Limbang. So for that will be quite You don't have McDonald's, you don't have a lot of things there. So after 3 years, I decided to quit the government and join Columbia Asia. So I've been joining this Miri branch of Columbia Asia for almost half a year. Yeah.
Wow. Okay. So half a year in Miri. Okay. I was wondering, Miri, how come Miri? Now we know because you were in Limburg before. Okay.
Yeah,
Yeah.
so close to
Uh,
him.
yeah. Awesome. What got you interested in ONG, Doc? If you can share with us.
Yeah, so initially when I do my medicine, I plan to do like dermatologies. Then subsequently when I do work as housemanship that time, I start to think I like surgery, I like medicine, I like some like radiographer things, like ultrasound scans. Then I think what will be the field that I can do all in one specialty, which is ONG. Because we got scan, we got surgery, we got medicine, we got babies. Uh, and also for me, because I grew up in two sisters, and I did see that how women suffer. So I like to help them if I can, because women are a lot of women problems, trouble, everything that I really inconvenience. I feel that we need to empowering women, especially in this now the era that women need to have equal right with the men. So I hope that my job and my knowledge can help them. uh, at the same time, while you're earning a living, you're helping someone is a wonderful job, then you create a
Wow.
passion out there. Yeah.
Yeah, okay. Wow, Dr. Soon, I think after this confirm got more fan club who's gonna go to you immediately. All right. Okay. So I'm seeing a lot of ladies. There's a lot of viewers right now. Maybe this is a very interesting topic for you. If you guys could actually write down what is it that you want to learn in today's episode, or what is it that you want to ask Doc in today's episode, please write your questions down, and then we can tier the questions towards what you want. Okay, or what you would like to know. So thank you, thank you, thank you. All right, Doc. So now that we know why you got into medicine, it was your sisters, and it was about empowering women. Um, why? Can you share with us why is it important that we talk about today's episode, which is diabetes during pregnancy? What are you hoping for the audience to take home after this episode?
Yeah, you see, diabetes during pregnancy is very common, especially in Malaysia. Malaysia, later I'll talk about the statistic. So Malaysia is almost one of the highest, uh,
In the
because
world?
almost, because our country is what? Number one obesity in Asia.
Okay.
So diabetes linked with obesity. So if based on some local study, also, okay, maybe I now just enlighten, US is 10%, but our Malaysia almost 21%, and some city, like some states like Terengganu studies almost 27%. So which is so common for all the pregnant women. That's why we need a screening awareness and how we can do to reduce the risk to the that of diabetes to the mothers and the babies. That's why it's
Mm,
very important, and it's because it's so common, and the impact to baby and mother can be quite significant.
okay, got it. All right. So, would you say that women in Malaysia are not aware that it's quite a high incident here,
I
diabetes?
I think they are aware, and also the MOH is actually doing all the screening, relatively very common screening, because now they reduce the guideline to all the age 25 above need screening, even you don't
Wow.
have other risk factor. So
Okay.
25 is very very low. 25 is almost like almost everyone get the screening. If you unless
Mm,
you're pregnant less than 25 years old. Yeah.
right.
That's why
Okay.
it's
Okay.
so common now. The pickup rate is also high.
Wow.
So it's good that this episode at least to help them that they not so worry about that, and something that you can do about that, because you'll be
Okay. Got
get
it.
you yeah, because you get shocked that, hey, why suddenly diabetes? I'm so worried. Why is that? I never got diabetes before, but I will tell you further what it will happen.
Wow. Okay. I did not realize it was so serious. Okay.
Yeah.
So awesome that we have you today. We're going to cover this so that everybody is aware. And even if you missed this episode, please share the link with your friends because you never know who it's going to make a difference to. All right. So let's get straight into it. Doc, in today's episode, what will you be covering about diabetes during pregnancy or gestational diabetes?
Yeah, so today I will talk about this overview first. What is gestational diabetes? How you get it, and the impact on mother and fetus, means your babies, and whom should be screened. Not everyone, but I just told you it's quite relatively almost everyone. So how and when to screen, management, diet control, which is the part that a patient can do, sugar monitoring, how to monitor, then OHA means a diabetic drug, the oral one, and the insulin, the injectable, and what is postpartum OGDT. Yeah.
Okay, got it. Sounds really exciting. I think we're going to be able to share our knowledge from today with other people as well. All right. So, Doc, let's get straight into it then. Gestational diabetes. If you can share with us, what exactly is gestational diabetes? When does it
Yeah.
happen and why?
So gestational diabetes is common and up to 10% of pregnant women. This is in US. As I say, Malaysia is 21%, and in Terengganu State specifically, one study showed 27%. It's so much higher compared to US and nationwide. So, but the important effect is if untreated, the pregnant diabetic mother can affect the health of baby and the mother. So I later tell what is the effect on that lah.
Mhm.
But with proper management, with proper follow up, with the doctor guidance, most women can have safe pregnancy and give birth to healthy babies.
Okay. All right. So, how does one actually get diabetes during pregnancy, a doc? Is it food? Is it genetics? Or is it something else?
Yeah, so that's a good questions. Okay, so you see diabetic, actually they got a few types of diabetics. No? It can be type 1, type 2, which is genetically you already got that. No? Type 1 is usually genetic, type 2 is usually lifestyles and it develop later and multifactorial. Okay, so when we talk about type 2 means before you're pregnant, you already have this diabetes. But this episode, we are going to focus on gestational diabetes. Specifically, it's a diabetes developed during your pregnancy. Okay, so how does it happen? It's because of the during pregnancy, there's a pregnancy hormone and also the placenta hormone. Okay, this hormone actually counteract the effect of the insulin. So insulin is actually the hormone that required to lower your blood sugar. After you're taking some food, your blood level sugar will spike up. But the body will naturally maintain the sugar back to normal level by using insulin. Okay. So because of this pregnancy, the hormone they counteract the effect of the insulin, end up your body become insensitive to insulin. So during this insensitive, most patients they can produce their pancreas can produce more insulin to counter this effect, and still they can maintain a normal blood sugar level. But there's some women with multifactorial reason, for example, obesity, elderly age, or the risk factor there, or diet, end up they fail to produce enough of the insulin. On top of this insulin resistance, then their body fail to regulate the sugar back to normal level. So they are persistently on the high side. So this will impact on the mother and baby, and this is called gestational diabetes.
I
And
see.
usually it will disappear after pregnancy because of the hormone, pregnancy hormone already disappearing there.
I see. Okay. And what is it that a lot of people don't understand about this in your experience?
My experience is diabetes is so common, and most people they don't understand because they worried. Is it I never got diabetes before, and why I suddenly got diabetes? Actually, if you got it, sometimes it's because of gestational, sometimes it's because pregnancy is the only chance for you to take a screening. I mean, for some people, they don't regularly go for health screening, and then during pregnancy is the time that we pick up this problem.
I see.
So sometimes we can call likely pre-gestational. When we test the sugar level, it's so high, like fasting more than 7, and then after 2 hours more than 11. Then this is likelihood that you already got diabetic before your pregnancy. So there's a chance that we screen, and at the same time it also help to pick up those already got the diabetes before because it's so high incident in Malaysia.
Okay. Wow. I didn't realize. I just assumed everything was gestational, but
No.
it's
Yeah.
also a time for for
A-
screening. Yeah.
yeah, as an opportunity for screening, actually.
Right. Okay. So some of them are gestational, and some of them could be they already have diabetes. They just don't know it because they didn't do any check. Right.
Yeah.
Okay. Cool. Now, Doc, let's go to the next slide. Yeah. What happens when a woman gets diabetes during pregnancy?
So as diabetes means your sugar level in your blood is high. So what happened during when the blood sugar high? It actually when the your blood sugar high, it actually cross the placenta and actually pass to the baby extra glucose that needed for the baby. And subsequently the baby can uh, de- develop the extra weight, then you're causing the baby to gain weight a lot and getting baby, we call macrosomia or large for gestational age. Means at that station, maybe like for example 37 weeks, your baby already at the size of 40 weeks. So this is called large for gestational age. When you more than 4 kg or 4.5 kg, we call it macrosomia. Yeah.
Wow. Okay. So the chances of the baby being big is actually much higher because of this
Yeah, because of
diabetes.
the sugar, you personally give more sugar. Just like if you like to eat more sweet, you get bigger, right? So the baby get
Yeah.
the same thing. Yeah. So what you eat, you impact your baby. Yeah.
Okay. Doc, what are some symptoms of gestational diabetes? How do you know if you have it?
Actually, most people they don't realize if you don't screen, they don't have any symptom of diabetes. Okay, so unless it's very high, you'll get a polydipsia, which is means you're very easy to thirsty, very easy to urinate because of the high sugar. But rarely we get so high level for that. Most of them they don't have symptoms. So it's important to screen, if not they become a silent problem that can affect the pregnancy and the baby because if you make it long lasting high sugar level without treatment without any intervention then the impact to the baby will be there.
Okay, got it. And what are the risk factors for gestational diabetes?
Okay, so can we go to okay, risk factor.
Mm,
Can we go to next slide?
yeah.
Okay, so if you got someone got gestational diabetes, they actually can increase the risk of preeclampsia. Preeclampsia is the condition which is called hypertension during pregnancy. Okay, they are linked together. Okay, because the sugar can actually damage some vessels. Just like the type 2 DM is diabetic is the same. It damage the vessels. So when it damage or make the placenta circulation problematic, then end up it can cause hypertension in pregnancy. Also, if the baby get bigger, you also end up more prone to cesarean delivery because of big baby cannot pass through normal birth canals, they end up getting a Caesar, or we call it macrosomia for baby, which is big. Yeah.
Okay. And what are some risks to mother and baby, I guess? Let's
Yeah.
go to
Can
it.
yeah. So you can see they can affect, just like I said, both on babies and mothers. Okay. So on baby, you will get high birth weight, low glucose level, means neonatal hypoglycemia. If you don't control sugar well, the baby persistently on the high sugar because they depend on high insulin. Then subsequently, when they deliver, it's a great problem for pediatric doctor also because of the low blood sugar. We call neonatal hypoglycemia. Okay, also causing jaundice and respiratory distress, and so there will be impact on the baby in the long term. Oh, if you get gestational diabetes, the baby tend to get diabetic during afterlife. Oh, means you develop diabetic during maybe adult during that time. So they are linked together. They got linked. So if you during the development of the fetus inside your womb, and then suddenly you develop a gestation diabetes, you might impact on their later life to get diabetic. Okay, so this is a long-term effect on the mother. Just like I said, it can cause hypertension. It also lead to IUD, intrauterine death. It die inside the womb, premature birth, means preterm delivery, or developing type 2 diabetic after delivery. So this is almost 50% of that. they will develop into diabetic in 10 years times. Yeah.
That's some serious side effects. Yeah.
Yeah, yeah.
Okay. So, Doc, who we spoke about this earlier. Who is usually at risk of having diabetes? Almost everybody in
Okay,
Malaysia, is it?
not everybody, but usually screen. But most case, this screening tools is just to screen to pick up. Doesn't mean everyone we screen will get a positive result. If a negative, mean you are safe from diabetic lah. So okay, whom should be screened based on the risk factor, based on the MOH guideline. Okay. So what you see in the photo there, 50 grams, 75 gram, 100 gram. This is a sugar that to drink to challenge your body whether they manage to bring down the your blood sugar level. So most people without diabetic, if they drink even 75 gram, you test in 2 hours, take the blood again, and then end up the level be normal. But if your body fail for this challenge, that's 75 gram, after you take in 2 hours, it still remain high. Means this is how we diagnose diabetic. Okay, so can we go to the next slide?
Yep.
Okay, so this is how soon we should screen and whom should be screened. This is the slide that they mentioned. If present any risk factor, okay. So the number one risk factor is body mass index more than 27. So body mass is, we call it BMI. Actually, if you count, if you don't know what is BMI, you can Google search that. And then also you can actually use your weight in kg, divide by height in meter, then you divide by height in meter again. You'll get a figure. If they're more than 27, means you are overweight, because the normal weight is up to 25. 25 to 30 is overweight. So 30 above is obesity, we call it. Okay. So for this group of patient overweight more than 27, we screen immediately. Once you're booking, we check directly. So previous history of GDM means your previous delivery or pregnancy also with diabetic, you are very high likelihood that this pregnancy will got diabetic also. So it's better to screen early rather than late so that we can intervene early.
Mhm.
Also, first degree relative with diabetic, for example, mother, father with diabetic, or even sisters. Okay. History of macrosomia means your birth weight of previous child more than 4 kg. So Asian rarely get a baby so big. So if suddenly get so big, maybe that time you got diabetic that undiagnosed. That's why if the birth weight previously you get 4 kg above, this pregnancy also suggests to screen. Okay. Bad obstetric history. As I said, the diabetic can cause a lot of problems, miscarriage, frequent miscarriage, intrauterine death, preterm delivery. So we call it bad obstetric history or hypertension. So when you got this kind of history, end up with screen also. So they to pick up earlier and manage earlier. If your urine that detected, usually we check for protein or infection or even sugar. If you got sugar in 2 time occasion, we also screen. Okay, or current obstetric problem, for example, you got hypertension, or the amniotic fluid, or is more than 20, we call it polyhydramnios, or the use of steroids, it also can affect the sugar level. So this group of patients we will screen at booking or as early as possible. Yeah. So for me personally, I will screen at booking unless you have this we call nausea and vomiting. So you eat whatever also vomit out, there is no point to screen that time because this sugar is not easy to drink. If anyone drink before, try sweet thing is nice, but too much sweets is very disgusting and difficult to drink. So when they already start with this giddiness or morning sickness, you ask them to drink this 75 grams, they'll just vomit out and that means you have to repeat again. So I will
Right.
wait till until they are okay and symptoms resolve, then we will screen them.
Okay. Doc, could it be possible that if you tested early, you're fine, and then later on you tested? th-
Yeah, that is a good question. This is exactly why the MOH guidelines state that even you screen negative with the risk factor when you're earlier time, because the peak incident at 24 to 28 weeks. So we will repeat a second one at 24 to 28 weeks. Of course, the third one is rarely repeat unless you suddenly develop, your baby get very big or your urine suddenly detected the sugar there. Then that time we will screen again, check again whether you got diabetic or not. Because you affect our management, whether mode of delivery, the timing of delivery.
I see. Okay, so you could be having multiple tests. Okay, got it.
Yeah.
Okay, and
So yeah.
hmm, what about
So
this
this
one, Yada?
is okay. So this is from the MOH guideline. So you see, the screening means at risk of develop means the risk just now I mentioned at booking or as early as possible. For women more than 25, because there's no point to screen earlier. End up you drink one more time. So 25 we'll screen at 24 to 28 weeks. Okay. The screening method is by 75 gram OGTT. Okay, just like the orange color one just now I showed you. I think orange taste is if not mistaken. So you drink that and then we will take two samples. The first sample should be fasting. Okay, usually it's fasting first. We take, it should be, if they're more than 5.1, means you diagnose diabetic. Then after that, you drink the sugar and then we repeat your blood test in 2 hours. If they're more than 7.8, means you got diabetic. So if you yes means you got diabetic, no, we repeat again in 24 to 28 weeks. Yeah. If they one of that
Mm,
positive, then you are considered diabetic. Yeah.
okay, got it. So that's how screening works.
Yeah.
Let's talk about treatment here, doc. Is there a treatment for diabetes during pregnancy? Is there a cure, or do we have to live with it and manage it?
Yeah, absolutely. Let's us go to next slide.
Mm,
So you see the management gestational diabetes is from diet, exercise, which is obviously from patient themselves, and medication and insulin is decided by doctors, and prenatal vitamins. Okay, let's stress on prenatal vitamins. So far, my patient all almost 70% they are quite aware of taking this folic acid because the folic acid pre-pregnancy can reduce risk of neural tube defect. And if got this diabetic, they actually require higher dose of this, which is 5 milligram. Oh, those type 2 diabetic, they need 5 milligram of folic acid to prevent the neural tube defect. So important to take the vitamins, and good habit means you frequent check your blood sugar, not to let it unchecked or high for very very long time unnoticed. So if you follow this 1, 2, 3, 4, 5, usually your pregnancy should be quite fine. Yeah.
okay. So it's about managing it, and it's a combination of food, exercise, medication, vitamins,
Yeah.
and good habits in checking your blood level. Yeah.
Yeah.
Okay, got it. What about diet? If we talk about diet during pregnancy, doc, there's so many out there. How do we know which one to follow? What's your advice?
My advice is diet. You eat in small portion, don't overeating. You can eat if you eat more frequently, is also fine. But because of our monitoring of blood sugar is by the interval after 2 hours, or so I prefer if you can don't snack in between so that the sugar don't derange too much. At the same time, take in small portion. Okay, don't try to skip meal and suddenly eat more of it. It will get your sugar very haywire. Okay, especially those we need to tailor to them for medication control or insulin. So imagine your blood sugar high, we give you higher dose of this insulin or these medications to lower your sugar. Then end up you not following your diet. End up you I give you higher, then end up you don't eat. Then end up you go into hypo, when hypo is the one dangerous for you and the baby. So this is difficult. So if we give you high, you become hypo. If we don't give you, then you eat more. So you have to very consistent in your diet, and that we can tailor to help you. Okay. If you go until that level that need OHA or insulin. So diet is very important to keep it small portion and know what you eat. So
Okay.
this I always stress that know what you eat, and so that I always want my patient if can self monitoring so that you can aware of what food you eat can affect your blood sugar. Okay, let's see the this one. So we
Uh-huh.
call it the plate methods.
Hmm.
So plate method is consists of 50% vegetables. The vegetables we prefer is non-starchy. Do you know what is starchy vegetables? For example, potatoes, corns, peas, green peas. They are all high in carbohydrate. So what we need is the green leaf, tomatoes, all these things are okay, carrots. 50% should be all the high fiber vegetables. Then 25% is protein rich food. For example, you can eat fish or meats, all these things. Then another 25% is fiber-rich carbohydrate, which called complex carbohydrate. So try not to eat the white rice or white those made with white flour, like for example the bread, white bread. If you can take wholemeal bread or some buckwheat, all these things, or brown rice should be even better than just plain simple sugar like cakes, all these things. So if you can follow this, usually you're in a healthy diet. Okay, can we go next slide?
Yeah.
Yeah, for this is example of food which call 50% of vegetables. For example, broccoli, asparagus, mushroom, carrots, zucchini. So non-starchy vegetable lah. They are all eggplant, peppers, cauliflowers, tomatoes, salad greens. Okay, then when we go about lean protein, you can take eggs. Eggs. If you say keep hungry, is I understand women tend to have cravings, hungry. So, but important is I didn't say you must fast or you cannot eat. Just choose the food that it won't affect your sugar. This is why important this message I want to bring to you all. Choose the food. You no need to fast. You actually hungry, you can eat. For somebody hungry, you eat eggs. You can eat fish, tofu, or lentils, beans. It's fine. Then drinks, you drink water or low calorie drink. Don't drink ayurveda, Milo, all can affect the sugar. A lot of my patients say Milo kosong, no sugar. Is that true? No. Milo kosong come with sugar. If not, the real glucose is very bitter. So usually it will affect the sugar. Try not to drink any ayurveda. So carbohydrates is the corns, sweet potatoes, all these things, limit to only 25%. So we go to next slide. So this example, you can eat the one quarter within, like for example, meat, the cooked meat, then you can 25% of carbohydrate and then 50% of the vegetables, and you can eat some small amount of fresh fruits. Fruits, beware, they are made of sucrose. Okay, sucrose when they break down, they turn into fructose and galactose. I mean the fructose and the glucose. Okay, so when the sugar, actually fruits is very sweet. Okay, so they can affect your sugar also. So eat in small amount. Try to control it. Okay.
Got it.
So this is all about diet. Okay.
Okay. And what is the 7-point blood sugar profile monitoring? Yeah, doc?
Okay. So this is we call 7-point blood sugar. Why 7 point? We're checking 7 times of your blood sugar. So basically, we actually ask you to check when you just wake up. You take one prick to your finger there, finger prick. Then you'll give you the value of your when you just wake up. What's your level? Then after that, you have your breakfast. Then after 2 hour breakfast, you check another time. This is we call second time. Then after that, before lunch, you check one more time. After lunch, 2 hours, you check one more time. Same for dinner. And before bed, you check one more time. So this totally becomes 7 times. No? So doctor different vary. They can ask you check 7 times in one day. Or I prefer is to check maybe first day we call staggered now. Staggered means you one day you check breakfast only before after. The next day you check before after lunch. The next day you check before after dinner. Okay. So this will give us a rough idea of whether you need the medication to control or not. Because for example, when you talk about diet, okay, when you just wake up, I eat nothing, I fasting, but the sugar is high. Can you do anything with that? It's very difficult. You need medication to help. But for those almost like that, or maybe before breakfast, it's okay. But after food, it suddenly spike up very high. For example, more than 6.7. This is where diet control can play in. Means the food that you eat will affect your postprandial sugar. So if you control the level type of foods you eat, then you can make into a normal level back. So I always like this 7-point BSP because patient self-monitoring, they can check at home or at their convenient time. I believe most people can afford to buy this glucometer because anyway, after all, 50% will get it in type 2. Okay, so invest one in glucose monitoring and then you check yourself at your convenience of your time, and you also can roughly know. And I always tell the patient the target before is 5.3, post is 6.7. This is your target. No point you ask them check and write down the figure which they don't get the target, so that tell them the target, they'll try to like scoring. Oh, I want to score hard to get back to the normal, but I want to pass this exam or these things. Oh, then they will try to control the diet, and then they realize they'll tell me which brand of milk will affect, what kind of food will affect the sugar level into a sky high, all these things. Then they will try to avoid that kind of food or eat in small portion. They always can tell, oh, like I today suddenly high, then I'll tell them, oh, today because I go to Raya, I have to open house, then end up very sky high. But this is occasionally is still fine. Okay, I prefer in the long term you don't get into a spike for multiple times for very long time. Okay.
So this is kind of like a report card, right? When do they
Yeah, it's
submit
a good.
this to you, doc? Like, is it
You,
weekly or monthly? How does it work?
I will depend. If the patient can give me a result which is good, usually 1 month time follow up should be okay. But they need to monitor themselves. If the 1 week's time that is tendency for me to start medications because it's so deranged, I need to see quickly. To, for example, I check, then I see there's no way the diet control can work. I need to start a medication. If they want to start a medication, I'll follow up more closely so that I can tailor the medication to bring the sugar back. Because people should understand that blood sugar in the long run for a very high, for very long level is not good. Okay, so we try to minimize the exposure to high sugar for prolonged time. So important, we will follow up closely if your sugar is not well controlled.
Okay. Doc, are there cases where because of what's happened, they really take care of their food? Can it actually reverse the diabetes? I'm just wondering.
Is it work once you get it, you there's no point we call it retest. Okay, like
Okay.
some people think, if I test, maybe I wrong that time. Can I retest again? There's no such thing called retest. Once you positive test is considered gestational diabetes. Whether
Okay,
your
got it.
sugar all the while is normal, control well, we will still label as gestational diabetes. Means you got
Mm,
this factor there. But good news, if you control well, it will reduce the risk, but it's not to absolutely zero like those without.
mm,
Those gestational diabetes will come high risk, even well controlled with the intrauterine depth. Some pregnant mother, there's no reason other than diabetic. Suddenly the baby just died. So there's such case also. And then only risk factor we found is diabetic. So
mm,
it actually link literature also link to that. So
mm.
whether you control or not, it reduce the risk, but not to zero. Okay.
Okay, got it. Right, Doc, what about what do we need to know about OHA and insulin?
So actually, OHA is oral hypoglycemic agent. It's like for
Mm-hmm.
example metformin. Most commonly we use during pregnancy. So this is you take during your medication without injection. So you ask you to take, but some side effect for example vomiting, diarrhea usually first 2 weeks. Then after that, your sugar hopefully can maintain. If the take until maximum still cannot maintain, and we will suggest to start the injectable, which is called insulin.
And what about postpartum OGTT? What do we need to know? What is it actually?
Okay, so postpartum OGTT means after 6 weeks, usually your hormone, pregnancy hormone, everything will reduce back to normal, the baseline. Okay, means it to the non-pregnant levels. So usually during 6 weeks, we presume you're really no longer pregnant, and then because we knowing that there's a 50% chance that you get diabetic in 10 years time, so usually we check whether you're still having the diabetic. Okay, so in 6 week time, we screen another OGTT test. If you got diabetic, then we will manage you as a type 2 diabetic. If you don't have, then we suggest yearly screening because we know the fact that 50% will get in 10 years times. Okay.
Wow. Okay. Okay, Doc. Lastly, when it comes to managing diabetes, what are some of the biggest challenge for your patients?
Biggest challenge is Malaysia food.
Okay, that is very true.
Because Malaysian food are so tasty, so many food, right? You ask a patient to control diet is very, very difficult, even non-pregnant. Imagine pregnant, there's one baby craving together with the mother craving, together with pregnancy more moody. You sometimes stress, you want time of craving, end up or sometimes emo. So you very difficult to ask them to control their diet, especially if they see one partner taking tasty food, or satay or cake or anything that I want, then you eat in front of them. Of course, it's a whole family that need to be supportive as well. If
The
not,
family is usually the
they
worst, doc.
yeah they're seducing them then so end up you pregnant, you get hungry easily, and then you want to control them. It's very difficult, and then this is end up some will just lie to the doctors. For example, they during they want to check, then end up they'll control during that week. Then after that week they are just like, but this one I usually tell them you fooling me is fooling yourself because this is your baby. The effect, as I told, the effect of you to your baby, just try to reduce for this pregnancy and try to eat healthy. Even it will reduce the type 2 diabetic. This is a bigger challenge.
Wow. Okay. Do you have any tips, especially when our biggest challenge is Malaysian food?
Usually, I think healthy is if lah. So far, I see someone who regularly go to exercise, which is more self body image conscious, or those like exercise, workout, running, any type of exercise. Those when you get exercise, you tend to get more conscious mind about your food because you got this idea of calorie intake, type of foods, health. Then actually once you exercise, you start to now got so many this Fitbit lah, the Apple Watch. You actually can track your calorie expenditure, and then whether you burn how much calorie there compared to how much food you eat. So if you have these habits, you end up you constantly remind yourself what type of food is it worth taking or not. If you don't have this habit, end up you just eat one chocolate only I can eat. But if you know one chocolate is how much calorie, almost equal to you run additional 1 km, then you might think I better just don't eat one piece of this chocolate because I need to balance that by running 1 km. So running 1 km is not an easy job. I mean, for most people to extra do that, I'd rather extra cut my food. So if you regularly have this habit, make it as habit. So end up you will just control healthy, and once you're healthy before pregnancy, you will get healthy during your pregnancy. Yeah.
True, true, true. Because it's so much work to lose weight, right? Yeah. Very
Yeah,
good
you just
tip, doc.
maintain. You need habits. Yeah,
Yeah.
regular.
And once you start exercising, you'll be like, yeah, if I eat that chocolate, there goes my 1 hour run today. Cannot.
True. Yeah,
Yeah.
yeah. So this will
So,
actually impact. So it's very good to make people exercise or healthy
okay.
diet.
Be conscious about your image. Very good tip,
Yeah,
Doc. Thank you so
yeah.
much.
You must feel yourself handsome, feel yourself beautiful. Then it was the best motivation for you. Trust me.
Yes. Okay, awesome. All right, let's go into a Q&A because the Q&A is going crazy right now. We've got a question from Cecilia Kaur. Cecilia is asking, will GDM lead to real DM in the future, Doc? What is GDM and DM? For
Yeah.
those who are tuning in who might not understand it.
So GTM is gestational diabetes mellitus, means this is a diabetes during pregnancy, and DM is a real DM means is a type 2 or type 1 diabetes. It's called pre-existing diabetic. Okay, so what we get? Yes, 50% risk in 10 years time means half of the population of diabetic they will get real diabetic mellitus in 10 years time. That's why we prefer every year you screen whether you still got or not. So that you don't get unchecked. You know, diabetic unchecked, what will happen? Potong kaki, potong apa, the
Oh,
heart,
no.
diabetic
Okay.
foot, right? The eye will get retinopathy, on the heart, diabetic on heart. I think it's diabetic man, right? So you got all the diabetic problem will be lead to that kind of questions.
Okay, got it. All right, there's a question from SPN. SPN, how are you? Welcome. Hi, Dr. Soon. Will a skinny mother have the risk of getting diabetes during pregnancy? Fantastic question. I also had that.
Yeah,
Good
it's a
job.
good question. Yes,
Mm,
it still got the risk because just like I say, the risk factor based on the age, based on whether your family history, because it's multifactorial. It can be a family history, or maybe you're skinny, but the food you eat is all the sugar things. Oh. Then also the the inheritance, maybe your father, mother got it. So if you got this risk factor, yes, you need to screen and you might have a risk. But of course, obesity is one of the risk factor. They get high risk compared to skinny one. Yeah.
High risk. Okay, got it. Um, Judy Chalk has a question. When a woman gets a GDM in their first pregnancy, will it occur for the next pregnancy? Good
Yes, if
question.
you got previous diabetic, it's very high risk for you to develop in the next pregnancy. That's why it's a risk factor. You screen you immediately. But some people I do see maybe they after they exercise, lose weight, all these things, end up we screen again, then no more. Okay,
Wow.
so it's
That's if they
possible.
make that's if they make life-changing choices, right?
Life changing choices. Sometimes you will just the second one don't have, the first one got.
Okay, got it. Okay, and Daphne's question is, what advice can be given to pregnant lady with GDM but baby size smaller than GA? Okay, I'm sorry. All these people who's tuning in, are you guys medic background or something? Okay.
What advice can be
So what
given
is
to
GA,
pregnant?
doc?
What advice can be given to pregnant lady with gestational diabetic but baby size smaller
Then
than gestation?
GA.
Okay, so usually if you got diabetic, the baby will most likely will get bigger. Okay, but there's some reason or some usually type 2 lah, it will get smaller also because it affect the placenta circulation. Oh, if you got smaller, nothing much you can do. You just eat normally, control your sugar within the range. But what doctor can do, they'll follow up your small baby, oh, so that to make sure when the growth is parallel with the placenta circulations. Because when the baby get bigger, they need more circulation, more oxygens to support. If the placenta vessel with high resistance, end up the baby will get not enough nutrient, it will impact on the brain development and even fetal death. So usually this kind of small baby we call IGR, small for gestational age. We will follow up closely, maybe weekly follow up. And we'll check one more is the umbilical vessels scan, which is a Doppler artery. Lah.
Okay, got it. Okay, Sarah Atika has a question. I have GDM plus metformin during pregnancy. Do I have to continue with diet control after delivery? And second question is, after delivery, I always feel thirsty. Is this a sign I have diabetes? Great question, Sarah.
Yeah, it's a great question. If you got GDM and metformin, usually you also come with diet control. This is the add-on, not a subtraction. Okay, so you got add-on. If you fail, you end up metformin you have to take. Okay, so after delivery, whether diet control or not is important. Just like I say, 6 weeks you check first. Okay, especially if you got thirsty or this sign, it can be some it can be a sign of diabetes also. So you have to check screening in 6 week times. If you screen negative, then it's fine. Means your sugar is not affected. Means you don't have diabetes. Yeah, but
Okay.
advise you to check every year.
Okay. Cordless has a question. GDM mother can try normal delivery?
Of course, diabetic managers it can normal delivery. There's no indication that say diabetic mothers must Caesar, unless there's a circumstances that the obstetrician think the baby is too big, uh, for your pelvic bone to pass through all these things, then end up you advise the cesarean section.
Okay, got it. Another question is from Laila Ila. Patient yang ada GDM and gestation 38/52, growth baby usually 36, 37, 52. Is that true or not? I have no idea what that means. Could you shed
Patient
some light
ada
on
GDM and there's a gestational 38 weeks grow babies. What you try to mean 38 weeks, 36, 37. So I think within when during our scan the 2 weeks difference is still fine usually. Huh? Usually we got a chart to plot. Especially what you see in the scan machine, they give you the prediction actually based on the general populations. So we got a specific population for Asian for Malaysia,
it?
to plot the chart because you know Western baby tend to get bigger. So if this formulation we apply to Asian is not so true, we have to use the general growth parameter, which is a population specific, to plot. But anyway, whatever you plot, important, we want to see the curve, whether the baby is growing too fast or it's plateau, we call it flatten the curve. Then that is one trigger the alarm.
Okay, got it. Hang on, yeah, let me just check. Okay, next question is from Natasha Bella. How long does it take for diabetes to go away after delivery? I think that's a very good question.
Yeah, just like I say, it's because of the pregnancy hormone it causing that, and then after 6 weeks, all your pregnancy hormones, all your body will go back into non-pregnant state. Okay, that's a time that usually will go away after 6 weeks. Yeah.
After 6 weeks. Okay, cool. I just assumed it was immediate, but apparently not. Okay, next question from Sarah Atika. Does drinking a lot of plain water help with GDM?
No, this is water does not have a GDM. They don't have insulin inside, and neither will it dilute the sugar inside. Okay, so
Okay,
usually drink water. Maybe your sugar too high, and now you get thirsty and drink more, and you go to pee more. But it does not reduce the sugar level. You need to control the amount of food, or take medication, or even insulin.
okay, got it. Okay, so there you have it, ladies and gentlemen. I think we're going to take a break from the Q&A. Thank you so much for your questions. Keep it coming because we're going to get back to this after the quiz. So right now, we're going to continue with the quiz. And as mentioned in the earlier part of the show, we've got some Columbia Asia water bottles up for grabs, and this is your chance, okay? But what do you need to do to win? First, you got to share this video out. Share it at least 3 times and remember to set the share post to public so that everybody can see. Next, answer the 3 questions that we're going to show on the screen in a single comment, and you are on your way to win the prizes. Okay, so let me repeat. First, share this video out 3 times and remember to set the post to public so everyone can see. Secondly, answer the 3 questions we will show on the screen in a single comment or a single line, and we will select the first 3 winners based on the correct answers and the shared post. Okay, so are you ready? All right, let's take a look at the quiz question. Okay, so the plate method involves, this is question 1. The plate method involves eating 50% carbohydrates, 30% protein, and 20% vegetables. True or false? The plate method involves eating 50% carbohydrates, 30% protein, and 20% vegetables. True or false? Question number 2 is diabetes during pregnancy brings extra glucose to the baby, causing the baby to lose weight and be skinny. True or false? Diabetes during pregnancy brings extra glucose to the baby, causing the baby to lose weight and be skinny. True or false? And question 3 is diet and exercise are the only ways to manage diabetes during pregnancy. Diet and exercise are the only ways to manage diabetes during pregnancy. True or false? So write down your answers in a single line, and our team will select the winners based on the correct answers as well as the video being shared at least 3 times. Yeah. Okay. So while waiting for the correct answers, let's go back to the Q&A. Okay. So Doc, this question is from Ara Devaharan. Good afternoon, Dr. Soon. For GDM mother, is it really necessary to do induced labor? If yes, may I know why? Thank you.
Okay, for gestational diabetes mother, it actually come with the risk of baby getting bigger or even intrauterine death. So there's a study to show the optimum time to deliver will be like 37, 39 weeks. Okay, and then if those with complication, usually for example, complication means the baby getting bigger already. So be 37, you can up to 39. Okay, but usually not, we advise not to go for post-date. Depend on how well your sugar control. If your sugar control well, we might allow the leeway of getting wait for your spontaneous labor, and we even can do a SNS, not really an induction of labor, which called membrane sweeping. Because you know that it's so difficult to pregnant up to the term, and then you know there's a silent killer there, you don't know when it will hit on and suddenly fetal death, because just like I say, the placenta circulation when during the baby peak is very important. So is it worth to get extra 1 week, extra 2 weeks, the waiting inside that you don't know when it will come out, and it getting bigger? When the bigger baby is more difficult to deliver. At the same time, the risk of death inside is there. You will increase after the post-date. So this is why sometimes with the risk factor mother, we prefer to induce after term. If you want to postpone, yes, you should understand, discuss with your obstetrician, understand the risk. We of course respect your choice, as long as you understand the risk is there.
Okay, got it. I think that's a fantastic answer, Doc. Yeah. This is not a question. Judy is saying, no doubt food is the culprit, and a lot of Malaysians saying definitely Malaysian food heaven kind of thing. Next question is from Carlos. Doc, any suggestion to lose some calories during pregnancy? Should pregnant mothers be looking at losing calories?
Actually, it's about us. You should not losing weight during pregnancy. Okay, but calorie is not to lose calorie, but you rather keep it to the portion that not affecting your sugar. Okay, so you should not focus on weight loss or this thing. Pregnant should not get weight loss. Okay, so but usually you will gain weight because the baby will gain weight also, and then it's important you have exercise during pregnancy. If you join my antenatal class, I got talk about exercise during pregnancy, what you can do. Okay,
Mhm.
so exercise during pregnancy, and also you focus on exercise means it's calorie burn output. Okay, then the food you take is a calorie input. So you have to calculate the input output roughly, and then to get it into a more or less the daily requirement. For example, 2,000 calories per day. Or pregnant women maybe 2,002, and then you maintain that level. Yeah. And then after that, you want to lose weight, try after postpartum. Then
Ah,
you no need to worry anything. You can go hard or even whatever marathon you want to do.
okay. In fact, there's a question from Me Lao. Post pregnancy weight loss advice, Doc? Since you see a lot of pregnant women and post.
Yes, post pregnancy, ideally, you can reduce back to your at least the pre pregnancy level. Okay, so usually go for breastfeedings. A lot of people say, or even studies say, show that if you breastfeeding, you help in weight loss because your body produce the milk and the milk consumed by the baby. So and that will help you weight loss very effectively. Breastfeedings, yeah,
Wow.
and
Okay.
exercise,
Breastfeeding.
lah, of course, yeah,
Yeah. And also continue the healthy habits that we were talking about, right?
yeah,
Mm,
absolutely.
okay. Right. Before I announce the winner, I've got one last question here, Doc. If there's only one, what actually two more questions. What's the most common mistakes people make when it comes to diabetes during pregnancy, in your experience?
Common mistake is, just like I mentioned previously, is they are unaware the diabetic they can affect on the mother because not everyone will get this complication. But we talk about risk. But when you talk about risk, sometimes patients don't understand what is risk. Because they cannot evaluate the risk because it's not something that certainly will happen. Okay, when you talk about risk, just like you counsel patient for surgery, it's the same thing. So, but when this diabetic, as long you understand it, then it's important for you to control, not to lie of your result, not to succumb or surrender to Malaysian food. That is a mistake. That if you surrender to Malaysian food, end up with losing a baby, for that thing, they will blame themselves. Yeah.
Mm, okay, got it. There is one question from Agnes. Doc, exercise during pregnancy, the best exercise, any suggestion? Which is a very good question, I think. Mm.
Yeah, exercise dependency can do actually swimming, walking, usually some prenatal yoga, or those antenatal yoga, which is not stress on the tummies, don't lie flat. Okay, usually just simple walking like everyone can do, but don't do something high impact, that injury of fall, injury of collisions. Uh, for example, horse
Okay.
riding, all these things, bicycle they can fall down. So all these simple exercises, walking is enough. Yeah.
Mm, okay, got it. And last question, Doc, if there's only one thing you want the audience to take home in today's episode, diabetes during pregnancy, what would that be? What do they need to know?
So it's not just for diabetic. They take this chance as awareness. Usually, one of the reason I choose ONG is because patients tend to get more aware of their health during pregnancy because for the sake of the baby, they start to think I my health is not just me, it's for the baby also. So on top of that, they are actually quite compliant, quite listen to doctor advice compared to those non-pregnant. Okay, so usually I liked that during the pregnant is a time that they can pick up their problems and they actually more conscious about the health and then to share the health with the babies. So important once you got the diabetic, take this chance to know what food you can eat. And this is also prolonged into a healthy habit. So after delivery, if you continue this weight loss, exercise, healthy food, if you maintain that, believe me, you'll get a good shape, and you'll get all these things. Your hair will be back, your skin will be good, you'll be get beauty, and then this will it's a vicious cycle. I see a lot of people vicious cycle in a negative way. That once they get obese and more obese and whatever lose weight, even more difficult to weight loss when you get until a level that is so difficult to move, and then even you move so hard, or not lose weight 1 kg not visible, cannot even downsize one of your clothes. So that kind of patient that they were very hard to motivate them. It's very hard. So try to not make yourself fall into that levels that if you ask me, I have encountered women that even obese until they have to take wheelchair because there's no way they cannot walk already. The knee cannot support the weight. So it's important if you maintain healthy and persistently healthy, you make it into a good habit. You can see Japan can do it. Japan people they eat healthy and they walk a lot, and obesity is never hit their country. But for us, the obesity is so common, because of Malaysian food, the another culprit. So
Yeah.
it's so common, and the obesity itself. And today I'm talking about diabetics, and obesity itself even worse. Obesity itself cause a lot, even more problem. Diabetic is just one of the risk factor for obesity. The obesity can cause fetal death, all these things, almost all the pregnancy complication increase with obesity. So I hope that you stay healthy, keep fit, let Malaysian people become good food but beautiful and healthy nation.
Mm,
Okay.
definitely. I think that's so true. I think we all need to work together because this obesity and unhealthy food is causing a huge problem health wise,
Yeah,
right? Yeah.
and hot weather you don't walk is another problem.
Yes. Yeah. We don't walk anywhere. But yeah, pregnancy is a fantastic time to start being aware of our health and taking it seriously. Yeah. So thank you so much, Doc. We also have our winners for the quiz. So before we announce who our winners are, let's find out the correct answers to the quiz, shall we? Okay, Doc, you're gonna help me with this, yeah? Okay, let's have a look. So the first question is the plate method involves eating 50% carbohydrates, 30% protein, and 20% vegetables. True or false, Doc?
So this is obviously false. If you remember, I showed you three times the slide.
Yeah.
So 50% is what? Vegetables. Okay, non-starchy vegetables. 25% of protein and 25% of complex carbohydrates.
Got it. And second question, diabetes during pregnancy brings extra glucose to the baby, causing the baby to lose weight and be skinny. True or false, Doc?
Yeah, this is false because the sugar, if you're high, you pass to the baby, and if you get fat, the baby will get fat. Okay, so the baby will get fat, not skinny.
Okay,
Okay,
got it. So the answer is false. Okay. And number three, diet and exercise are the only ways to manage diabetes during pregnancy. True or false?
false because it's not the only way. Of course, there's a medication out there that you can take orally or injectables.
Mm, definitely. Okay. Thank you. And good habits, right, Doc? Good
Yeah,
habits is also important because we need to take our blood and to check.
but
Um,
monitoring. Yeah.
yes. Okay. So congratulations to our winners. And our winners are Natasha Bella, Sarah Atika, and Sky Yun. Congratulations to our winners. What's going to happen is that we're going to be contacting you after this within a day to get your details. So be sure to check your FB Messenger inbox so you can get your prizes. Okay. So congratulations to our winner, Natasha Bella, Sarah Atika, and Sky Yun. Doc, thank you so much for today. I've learned a lot, and based on the feedback from everyone here, they are saying that it's been such an informative session, And definitely, I think you're gonna get more fan club and more clients after this lah. Okay, so congratulations to our winner. Thank you so much, Doc, for such an informative episode. I hope that was super insightful for each and every one of you as well. Yeah, what are your biggest learning from today? Please share in the comment section. And for me, definitely, I think for me, pregnancy is a time, is one of the best times to have a look at your overall health, not just for the sake of the baby, but for you as well. And it's about having important good habits. Yeah. So thank you so much. Kind of thing. So thank you so much for an insightful session. Loving everything, getting so much value from today. So unfortunately, that's all the time what we have for today. And if you know someone who will really appreciate today's tips, info, and insights, please share this video out, tag them, because you never know who you're going to make a difference to, and give us a lot of likes and love while you're at it. Thank you so much. Till then, a huge round of applause to Dr. Soon. Okay, and take care of yourself and each other, and we'll see you in the next episode. Yeah, thank you.
Thank you, Nina. Thank you.